All right, everyone, we've reached the heart of our presentation, which is the ethical evaluation. This is where we move beyond simply knowing the principles and start applying them to real world situations. This is what separates a good nurse from an ethically excellent nurse. We're going to learn how to analyze complex scenarios, identify ethical conflicts, and make sound judgments that prioritize patient well being and uphold professional standards. Think of this section as your ethical toolkit, the skills and knowledge that you will need to navigate the moral challenges that you're going to face in your nursing career. By the way, how many of you feel confident in your ability to analyze an ethical dilemma right now? But don't worry if you don't, because that's what we're here to learn in this session. But before we dive into specific cases, let's quickly review the essential elements of moral acts. Remember this from our previous lesson? No, but it's so fundamental right now that it's worth revisiting. And these elements help us to break down a complex action into its key components, allowing us to analyze it more systematically. Think of these elements as the ingredients of a moral act. We need to understand each one to understand the whole. So, what are the four elements we need to consider? These are the act or the object, the intention, the circumstances, and the outcome. Now, for the act or the object, we ask what is being done, and this is the action itself. Is the action intrinsically good, evil, or neutral? It's important to consider the nature of the act itself. Like, for example, amputation. Is it a good act? Yes, in certain circumstances, it can be a good act because it saves a life. It's not inherently evil. But what are some examples of acts that are intrinsically evil? Next is the intention, and we ask, why is it being done? This is the agent's motive or purpose. What is the person trying to achieve? It's about understanding the why behind the action. Like, for example, in beneficence, wanting to help the patient. Is it a positive intention? What if the intention is to harm the patient, even if the act itself is seemingly good? How does that change the ethical evaluation? So think about it. Then next is the circumstances. This is the context and situation. These are the conditions surrounding the act. They can significantly influence the morality of the action. Like, for example, necessary when no other means available. What if there were other, less drastic options available? How would that change the ethical evaluation? The circumstances provide the context for understanding the action and the intention. Okay? Now for the outcome. These are the results and the consequences. These are the effects of the action. It's important to assess the outcome separately, from the act itself. Like, for example, patient survival, quality of life. What if the patient survives the amputation but experiences significant pain and disability? How does that affect the overall ethical evaluation? Okay? The outcome helps us to determine whether the action was truly beneficial, right? The next is um, I want you to think about it. Let's try a quick exercise. Think of a common nursing action like administering medication. What is the object of this action? What is the intention? What are some potential circumstances that might affect the morality of this action? And then what are the consequences? What is the outcome of administering that medication? Okay, so you can reflect on it and try to determine these elements of this action, the administering medication. Now the question to ask is how this framework helps. Okay, this framework is not just an abstract exercise. It's a practical tool that can help you to make sound ethical judgments in complex situations. It provides a systematic analysis of ethical decisions, connects to moral philosophy and ethical theory, and encourages critical thinking in case studies, and aligns with professional ethical standards. It's a way to ensure that you are considering all of the relevant factors and that you are making decisions that are consistent with your ethical values. By using this framework, you can approach ethical dilemmas with confidence and clarity. Now, ethical dilemmas often arise when there are conflicts between different ethical principles. It's rare that an ethical decision is clear cut, okay? Often, you'll find yourself torn between competing values. So let's explore some common conflicts involving beneficence, which is the principle of doing good. Now, these conflicts are at the heart of many ethical challenges in nursing. So there are conflicts about autonomy versus beneficence. Like for example, a patient refusing life-saving treatment. This is a classic ethical dilemma. How can you balance the patient's right to choose with your duty to act in their best interest? What are your responsibilities in this situation? What are the limits of patient autonomy? Another example is a conflict between justice versus beneficence, specifically in resource allocation dilemmas. Say, for example, you have limited resources and you must decide who gets them. How can you ensure that all patients receive the care they need when resources are scarce? How do you prioritize patients in a fair and equitable way? Hmm? Another example is a conflict between non maleficence versus beneficence. Like when there are necessary painful treatments. Sometimes the only way to help a patient is to cause them pain. Now, how can you minimize harm while still providing beneficial treatment? How can you balance the potential benefits of a treatment with its potential risks? Okay. Next example is a conflict between confidentiality versus beneficence. Like when we are protecting the patient or others from harm. You have a duty to protect patient confidentiality. But what if that confidentiality puts someone else at risk? When is it justifiable to break confidentiality to protect someone from harm? What are the legal and ethical implications of breaking confidentiality? Quite challenging, right? Now, I want you to think of a time when you experienced a conflict between two ethical principles. What were the principles involved? What made the situation so challenging? How did you resolve the conflict? What did you learn from the experience? Now, the question is, how do you navigate these complex ethical dilemmas? Because it's not easy, but there are some steps you can take to make sound ethical decisions. And these steps are designed to help you to think critically, to consider all of the relevant factors, and to make an ethically sound judgment and decision. Okay, now let's put on our ethical detective hats and dive into our first case study. This one involves a patient with a gangrenous foot who needs an amputation to save their life. This is a scenario that many of you might encounter in your future nursing practice. It's a challenging situation because it involves a painful and disfiguring procedure, but it's also potentially life saving. Now let's paint this picture. We have a patient with a gangrenous foot. The infection is spreading rapidly, and the medical team has determined that amputation is the only way to prevent it from becoming life threatening. Well, the patient is aware of the situation, but they are understandably hesitant to undergo such a drastic procedure. They're worried about the pain, the disability, and the loss of a limb. So, what are your initial thoughts and feelings about this case? Well, whatever you're feeling and thinking right now, that is a natural reaction because these are difficult situations for everyone involved. So, what's the ethical conflict in this case? What are the competing values or principles that are at stake? Yes, exactly. We have a conflict between beneficence and non maleficence. On the one hand, we want to save the patient's life. On the other hand, we don't want to cause them unnecessary pain and suffering. But how do we balance these competing principles? Now, from a beneficence perspective, amputation is the best way to promote the patient's well being and save their life. It's about acting in their best interest, even if it involves a difficult and painful procedure. But what are some specific ways that amputation would benefit the patient in this case? So, what do you think? Now, from a non maleficence perspective, amputation would cause significant harm to the patient. It would involve pain, disability, and the loss of a limb. Now, how can we minimize the harm associated with this procedure? What steps can we take to ensure that the patient is as comfortable as possible? Now, after careful consideration of all these factors, the medical team decides to proceed with the amputation. This decision is based on the belief that the benefits of saving the patient's life outweigh the harms of the procedure. However, this decision is not made lightly. It requires careful planning, open communication with the patient and their family, and a commitment to providing the best possible care. Now, here's the justification for that decision based on the principle of double effect. The act of amputation is not inherently wrong because it is intended to save the patient's life. Okay? Also, the harm, which is the pain and the disability, is not the goal of the action. It's an unavoidable side effect, but it is a harm not directly intended. Next, the good effect, which is the saving the patient's life, is not achieved by means of the bad effect alone, by amputation. In fact, saving life, the benefit of saving the patient's life outweighs the harm of losing a limb, and there are no other means available. Amputation is the only way to stop the infection from spreading. The life-saving effect of the amputation is also immediate. But of course, the patient must be fully informed about the risks and benefits of the procedure and must give their voluntary informed consent. Also, the medical team must provide adequate pain management to minimize the patient's suffering. And the patient should be offered prosthetic and rehabilitation services to help them adjust to their new situation. Okay? Now, I want to ask you, do you agree with this justification? Why or why not? What are some potential weaknesses in this argument? I want you to think about it, and if you think of any potential weakness, you can write about it, no? And let's discuss it next time, no, in class. Now let's break down the moral analysis using our framework, no, the framework that we've talked about a while ago. This is where we really dig into the ethical implications of this decision. Now, the act or the object, amputation saves patient's life, which is a good object. The act itself is intended to achieve a positive outcome. Do you agree that saving a life is a good object? Okay. Then next, let's explore the intention. Providing life-saving treatment is a good intention. Now, the intention is to help the patient and to prevent them from dying. Now, is this a morally justifiable intention? Okay. Next, let's examine the circumstances. Gangrenous condition threatens life. No other means available uh, no, to treat a gangrenous condition. The circumstances are dire and there are no other options available. Does this make the decision to amputate more ethically acceptable? Okay, then next is the outcome. The patient lives, loses limb but survives, which is a positive outcome overall. The outcome is that the patient survives, but they are left with a disability. Is this a positive outcome overall? How does the patient's quality of life factor into this ethical evaluation? Now, I want you to put yourselves in the patient's shoes. How would you feel if you were faced with this decision? What factors would you consider? What would be most important to you? You can reflect on it, write about it in your journal, and you can share it, no, during our class discussion. All right, let's tackle another challenging scenario. This time, we're dealing with a mass casualty incident where resources are severely limited. This is a situation that unfortunately nurses around the world sometimes face, whether it's due to a natural disaster, a terrorist attack, or other large scale emergencies. This case will really test your ability to think critically and make difficult decisions under pressure. Now, how do you think you would handle this situation? So imagine this, a major earthquake has struck, and you are one of the first nurses to arrive on the scene. There are 10 injured patients, all with varying degrees of severity. Some are critically injured and need immediate medical attention, while others have serious or moderate injuries. The problem is there are only 3 ambulances available to transport patients to the hospital. This means that Some patients will not receive timely care, and some may not survive. So, what are your initial thoughts and feelings? What are the immediate challenges that you face? Okay. Now, what's the ethical conflict in this case? What are the competing principles that are at play? Obviously, we have a conflict between justice and non maleficence. We want to provide fair and equitable care to all patients, that is justice, but we also want to minimize harm and save as many lives as possible. That's non maleficence. Now, how do we reconcile these competing principles when resources are so limited? Well, from a beneficence perspective, we want to help all patients and provide them with the best possible care. But in this situation, that's simply not possible. We can't help everyone equally because we don't have the resources. So, how do we decide who gets help and who doesn't? From a non maleficence perspective, we want to minimize harm to all patients. But we know that some patients will inevitably experience harm due to the lack of resources. Some may not receive timely care, and some may even die. How do we justify causing harm to some patients in order to save others? Now, in this situation, no, the most ethical course of action is to apply triage protocols. This means using a standardized system to assess the severity of each patient's injuries and to prioritize those who are most likely to benefit from immediate medical attention. One common triage method is the START method, simple triage and rapid treatment. This method involves assessing patients based on their ability to walk, their respiratory rate, their perfusion, and their mental status. Excuse me. Patients are then categorized into four groups. Immediate is red, delayed is yellow, minor is green, and expectant is black. Okay? Now, here's the justification for this decision. Medical necessity dictates priority. Excuse me. Triage protocols are based on objective medical criteria and are designed to prioritize those who are most likely to survive with timely treatment. Greatest good for the greatest number. Triage aims to save the most lives possible with the limited resources available. Now, triage protocols are applied fairly and consistently to all patients. That's justice, regardless of their background or circumstances. While non-maleficence is minimized, triage minimizes harm by ensuring that the most critical patients receive immediate attention. Okay? There is also transparency in criteria. The triage criteria are clear and transparent so that everyone understands how decisions are being made. All patients are continuously monitored to ensure that their condition does not deteriorate. Families are kept informed of the triage decisions and the reasons behind them. Harm unavoidable but justified by necessity. So while harm is unavoidable in this situation, it is justified by the necessity of saving as many lives as possible. Now, I would like to ask you, do you agree with this justification? Why? Or why not? What do you think are some potential challenges in implementing triage protocols in a real world mass casualty incident? Okay, I want you to think about it and then let's discuss your thoughts during our class discussion. Now let's break down the moral analysis using our framework. For the act or the object, applying triage protocols, which is a structured method for resource allocation, the act itself is a systematic approach for prioritizing care. Okay? Now, for the intention, to save the most lives possible in a mass casualty incident, uh, it's good. The intention is to maximize the number of survivors. For the circumstances, limited resources, only 3 ambulances, but multiple patients with varying degrees of injury, the context is one of scarcity and urgency. So that's the circumstances. And then for the outcome, some patients receive timely care, while others may experience delays or not survive due to limited resources. So the outcome is a mixed bag, with some patients benefiting and others suffering. So imagine, no, you are a nurse in this situation and you have to tell a family that their loved one will not be transported to the hospital because they have been triaged as expectant, no, or black. Um, Meaning expecting death. How would you approach that conversation? What would you say? How would you deal with their emotions? Because that's another concern at this point. So I would like you to reflect on that as well, and yeah, we can bring into our class discussion processing of these thoughts if you think there's a need, no, to process them. Okay. Okay, let's move on to another challenging scenario that highlights the complexities of resource allocation. This case involves a hospital with limited ICU beds and multiple critically ill patients in need of intensive care. This is a situation that many hospitals face, especially during times of crisis or when resources are stretched thin. Now, how do you think hospitals should decide who gets access to limited resources? So imagine this. Your hospital has only 3 ICU beds available, but there are 5 critically ill patients who need ICU care. So 3 ICU beds available, but 5 critically ill patients who need ICU care. All of these patients are in serious condition, but their prognosis vary. Some have a higher chance of survival than others. The medical team must decide which patients will receive the limited ICU beds. This is a difficult decision with life or death consequences. So, what are your initial thoughts and feelings about this case? What do you think are the key factors that you would consider? And what's the ethical conflict in this case? What are the competing principles that are at play? So obviously, we have a conflict between beneficence and justice. We want to help all patients and provide them with the best possible care, that's beneficence. But we also want to allocate resources fairly and equitably, that's justice. Now, how do we again balance these competing principles when we can't help everyone? Well, from a beneficence perspective, we want to provide ICU care to all 5 patients, as it could potentially improve their chances of survival. But since we only have 3 beds available, we can't help everyone equally. How do we decide which patients to prioritize in order to maximize the overall benefit? From a justice perspective, we want to allocate the ICU beds in a fair and equitable way. But what does fairness mean in this situation? Should we give everyone an equal chance, regardless of their prognosis? Should we prioritize those who are most likely to survive? Or should we consider other factors, such as age, social status, or contribution to society? No? What are some different ways to define fairness in this context? Now, here's some information about the 5 patients. Patient A is 30 years old, trauma, with trauma, no? 85% survival rate. Patient B is 75 years old, with respiratory failure, 60% survival rate. Patient C is 45 years old, who suffered cardiac arrest, with 40% survival rate. Patient D is 25 years old, who went through septic shock and who has 70% survival rate. While patient E is 55 years old, who had stroke, with 50% survival rate. Now, based on this information, which patients do you think should receive the ICU beds? And why? Now, for the final decision in this situation, the most ethical course of action is to allocate the ICU beds to patients A and D, who have the highest survival rates. Okay? So this decision is based on the principle of maximizing the overall benefit and saving the most lives possible. However, this decision is not without its ethical challenges. What about the other patients? What are our responsibilities to them? Now, here's the justification for that decision. We apply justice fairly, which is the objective criteria. Now, the decision is based on objective medical criteria, which is the survival rate, and is applied fairly to all patients. We use the medical prognosis for the survival rate. The decision prioritizes those who are most likely to benefit from ICU care. Also, the principle, the greatest good for the greatest number. The decision aims to save the most lives possible with the limited resources available. There must be transparency also in criteria. In this case, the criteria for allocation are clear and transparent so that everyone understands how decisions are being made. The decision ensures also that the available resources are used in the most effective way. While all patients should be continuously monitored to ensure that their condition does not deteriorate. And of course, most importantly, we communicate to the families. Families are kept informed of the allocation decisions and the reasons behind them. Now, I would like to ask you, do you agree with this justification? Why or why not? What are some potential criticisms of this approach? What other factors might be relevant to consider in this situation? And while you are thinking about that, now let's move on to the moral analysis of that decision. Let's break down the moral analysis using our framework. For the act or the object, which is allocating scarce ICU beds based on the objective medical criteria, the survival rate, the act itself is a structured approach to resource allocation. Okay? The intention is to save the most lives possible with the limited resources available. The intention is to maximize the number of survivors. in this case. For the circumstances, limited ICU beds, which is 3, and with the multiple critically ill patients that are 5 with varying prognosis, this context is one of, again, scarcity and urgency. For the outcome, 2 patients receive life-saving care, okay, which is the patients A and D. So who are those patients again? Patient A is the 30 years old with trauma who has 85% survival rate. And patient D is 25 years old with septic shock and who has 70% survival rate. Okay, so these two patients receive the life-saving care, while others may not survive due to lack of access to ICU. So the outcome is actually again a mixed bag, with some patients benefiting and others suffering. So imagine you are a nurse caring for one of the patients who did not receive an ICU bed. How would you feel? What would you say to the patient and their family? How would you cope with the emotional distress of the situation? Remember, one of the responsibilities to continuously monitor these patients so that their condition does not deteriorate. And who again are these patients? The 75 years old with respiratory failure with 60% survival rate, the 45 years old with cardiac arrest who had 40% survival rate, and the 55 years old who had stroke with 50% survival rate. So of course, this is an emotionally distressing situation. How would you cope with this? So as you continue in your nursing program, I would like you to continue reflecting on this situation. And from time to time, write in your journal your thoughts about it, what you have learned in the process. Now, this case presents a very difficult and sensitive situation: elder abuse. As nurses, you are often in a position to witness or suspect abuse, and it's crucial to know how to respond ethically and legally. Elder abuse is a serious problem in the Philippines, and it's often underreported. This case will challenge you to consider your responsibilities, to protect vulnerable patients, even when it means breaking confidentiality and potentially facing personal risks. So imagine this. You are caring for an 82-year-old patient who has been admitted to the hospital for malnutrition and dehydration. During your assessment, the patient confides in you that they are being physically abused by their son, who is also their primary caregiver. The patient tells you that their son withholds food and medication as a form of punishment, and that they are afraid to report the abuse because their son has threatened to harm them further. The patient begs you not to tell anyone. So, what are your initial thoughts and feelings? What are the ethical and legal considerations that come to your mind? And what's the ethical conflict in this case? What competing principles are at play? And yes, we have a direct conflict between confidentiality and beneficence. Well, the patient has a right to have their information kept private. but you also have a duty to protect them from harm. Now, how do you balance these two competing principles when the patient's safety is at risk? Quite a challenge, huh? Now, let's explore the ethical principles. From a confidentiality perspective, of course, you have a duty to protect the patient's privacy, no? And, well, to keep their information private, no? Of course, especially to keep their personal information confidential. No? This is a fundamental ethical principle that is essential for building trust between patients and healthcare providers. However, confidentiality is not absolute. There are certain situations where it may be necessary to break confidentiality in order to protect the patient or others from harm. What are some arguments in favor of upholding confidentiality in this case? Now, from a beneficence perspective, you also have a duty to protect the patient from harm, and this includes protecting them from physical abuse, neglect, and exploitation. In this case, the patient is being physically abused by their son, and their health and well being are at risk. Now, what are some arguments in favor of breaking confidentiality in this case in order to protect the patient? So, I want you to take a pause and answer these questions on your own. Well, now for the final decision in this situation, the most ethical course of action is actually to report the abuse to protective services, even though it means breaking confidentiality. This decision is based on the belief that the patient's safety and well-being are paramount, and that the risk of further harm outweighs the duty to protect their privacy. However, this decision should not be made lightly, of course. It requires careful consideration of all of the relevant factors and a commitment, no, to protecting the patient's rights and dignity. Okay. Now, here's the justification for that decision. Abuse causes serious or irreversible harm. So the abuse is causing physical and emotional harm to the patient and is putting their life at risk. In fact, the 82-year-old patient was admitted to the hospital because of malnutrition and dehydration. So obviously there seems to be neglect. Okay. Now, the legal obligation is mandatory reporting. In many jurisdictions, healthcare providers are legally obligated to report suspected cases of elder abuse. Okay, so you might want to check that, no, in our Philippine laws. Um, in this case, beneficence is paramount. Protecting life uh, outweighs privacy. The duty to protect the patient from harm outweighs the duty to protect their privacy. Okay? Confidentiality is subordinate to preventing harm. Confidentiality is not absolute and can be overridden in situations where it is necessary to prevent harm. Okay? But of course, there has to be minimal disclosure. It should only be disclosed only to authorities. The disclosure of confidential information should be limited to what is necessary to protect the patient. Okay? So protect patient safety by removing them from harm. The goal is to remove the patient from the abusive situation and to ensure their safety. Also, provide alternative care arrangement. The patient should be provided with alternative care arrangement such as a safe place to live and access to medical and social services. And most importantly, document thoroughly the decision to report the abuse and the rationale behind. No, behind the reporting should be thoroughly documented in the patient's medical record. Okay? Now, I want to ask you, do you agree with this justification? Why or why not? What do you think are some potential risks and benefits of reporting the abuse? What are some alternative courses of action that could be taken in this situation? So I want you to take note of your answers in your journal, and you can keep it with you. And again, as you progress through your nursing course, you can from time to time check on literature, updates, and check on yourself. What will be your thoughts by then? Okay? And while you are doing that, now let's proceed to the moral analysis. Let's break down the moral analysis using our framework. For the act or the object, reporting abuse, which is protecting vulnerable person, no, the act itself is about protecting the patient from harm and ensuring their safety, which is good. The intention, which is preventing further harm to the patient, is a good intention. The intention is to stop the abuse and to provide the patient with a safe and supportive environment. For the circumstances, patient in abusive situation with the son threatening worse harm, this is the coercive context. No? The circumstances are dire and the patient is at immediate risk of further harm because of that threat. So that's the circumstances. Now for the outcome, patient safety is ensured. Abuser, well, stopped. Patient receives protection. That's basically justice and beneficence. The outcome is that the patient is removed from the abusive situation. The abuser is stopped and the patient receives the care and the support that they need. No? This is actually a very difficult and emotionally charged situation. What do you think are some strategies that you can use to cope with the stress and moral distress of reporting elder abuse? Remember, you will be the one to report and document. So, for sure, you will be experiencing so much stress, moral distress. No? So, what do you think will be your strategies to cope with that situation? How can you support the patient also throughout this process? What resources are available to you and to the patient? Okay? This case brings us to a situation that you will almost certainly encounter at some point in your nursing career. A patient who refuses treatment. This can be incredibly challenging, especially when you believe that the treatment is necessary to save the patient's life. Now, how do you balance your duty to care for the patient with their right to make their own decisions? So imagine this. You are caring for a 65-year-old patient who has been diagnosed with stage 2 breast cancer. She has completed a lumpectomy and the doctors have determined that she is curable with chemotherapy. However, the patient refuses chemotherapy because she is terrified of the side effects, which she has seen firsthand in friends and family members. She is competent and understands the risk of refusing treatment, but she is adamant that she does not want to undergo chemotherapy. So, what are your initial thoughts and feelings about this case? What are the key factors that you would consider in this situation? And what is the ethical conflict in this case? what are the competing principles that are at play? Obviously, we have a conflict between autonomy and non-maleficence. We want to respect the patient's right to make their own decisions. That is autonomy. But we also want to prevent her from harming herself by refusing a potentially life-saving treatment. That's basically the principle of non-maleficence. So how do we navigate this ethical dilemma? Let's now explore the ethical principles. From an autonomy perspective, the patient has the right to make her own decisions about her medical care, even if those decisions seem unwise or harmful to others. The right is based on the principle of self-determination and the belief that individuals have the right to control their own bodies and their own lives. So, what are some arguments in favor of respecting the patient's autonomy in this case? From a non-maleficence perspective, we have a duty to prevent the patient from harming herself by refusing a potentially life-saving treatment. We want to protect her from the consequences of her decision, even if it means overriding her wishes. What are some arguments in favor of overriding the patient's autonomy in this case? Now, the key question in this case is, does the patient's right to refuse treatment override the healthcare provider's duty to save life? This is a complex question with no easy answer actually. It requires careful consideration of all the relevant factors and the commitment to respecting the patient's wishes as much as possible. Now, for the final decision, in this situation, the most ethical course of action is to honor the patient's refusal of treatment while providing palliative care and continuing supportive dialogue. No? This means respecting her autonomy and her right to make her own decisions, while also providing her with the support and information she needs to make an informed choice. Excuse me. It's about finding a balance between respecting her wishes and providing her with the best possible care. Okay? Now, for the moral analysis, let's break down the moral analysis using our framework. For the act or the object, honoring the patient's choice to refuse treatment, the act itself is about upholding the patient's right to self-determination, which is good. No? For the intention, respecting the patient's autonomy and dignity. Uh, the intention is to empower the patient to make her own decisions and to live her life according to her own values. So that's also good. For the circumstances, patient is competent, understands the risk, and refuses voluntarily. So the context is one of a competent patient making a well-informed decision. For the outcome, the patient maintains autonomy, receives alternative care, and trusts the healthcare team. So the outcome is that the patient feels respected and empowered, even if her decisions, well, leading to a less desirable medical outcome, no, will happen. Now, I want you to think about some specific strategies that you think you could use to provide supportive dialogue and palliative care to this patient. How can you help her to cope with her fears and anxieties? How can you ensure that she feels respected and supported, even if you disagree with her decision? So I want you again to take note of your thoughts, your reflections about this in your journal, and revisit them from time to time, no, as you go on with your nursing journey. Okay. And here's another case. This case brings us to a complex situation where a patient is demanding a treatment that you believe is harmful to them. This is a challenging ethical dilemma that requires you to balance the patient's autonomy with your duty to do no harm. No? What are your responsibilities when a patient is making a request that could potentially endanger their well being? So imagine this: you are caring for a patient with terminal stage cancer who is experiencing severe pain. The patient is competent and understands the risks of opioid medications, but they are demanding excessive doses of opioids, far beyond what is considered safe or medically necessary. They are insistent that they want to be completely pain free, even if it means risking respiratory depression, coma, or death. No? So, what are your initial thoughts and feelings about this? What are the key ethical and legal considerations that comes to your mind? And what's the ethical conflict in this case? What competing principles are at play? Because obviously we have a conflict between autonomy and non-maleficence. We want to respect the patient's right to make their own decisions about their medical care. But we also have a duty to do no harm and to protect them from the potentially deadly consequences of an opioid overdose. So, how do we navigate this difficult situation? From an autonomy perspective, the patient has the right to make their own decisions about their medical care, even if those decisions seem unwise or harmful to others. This right is based on the principle of self determination and the belief that individuals have the right to control their own bodies and their own lives. Now, what are some arguments do you think in favor of respecting the patient's autonomy in this case? Okay. Now, on the other hand, from a non-maleficence perspective, we have a duty to protect the patient from harm, even if it means overriding their wishes. We want to prevent them from overdosing on opioids and experiencing respiratory depression, no, or coma, or even death. So, what are also some arguments in favor of limiting the patient's autonomy in this case? Okay, so take note of your answers. Now let's proceed to the final decision. In this situation, the most ethical course of action is to provide the patient with the maximum safe relief possible, while refusing to administer excessive opioid doses that could cause respiratory depression, coma, or death. This means carefully assessing the patient's pain level, exploring alternative pain management strategies, and providing them with honest and transparent information about the risks and benefits of opioid medications. It also means setting clear boundaries and refusing to comply with their demands for harmful doses of opioids. Okay? Now, here's the justification for that decision. The patient has capacity. Yes, the patient is competent and understands the risks of opioid overdose. When we apply the double effect, the intention is to relieve the patient's pain, not to cause them harm. When we try to compare harm versus benefit for proportionality, the potential harm of an opioid overdose outweighs the potential benefit of complete pain relief. Okay? So we have to explore alternatives. The medical team will have to explore alternative pain management strategies. No, but maybe they have not been effective. That's why the patient kept on insisting, no, for higher doses. In this case, the medical team recognizes the importance of respecting the patient's autonomy, but they also have a duty to protect them from harm. So the goal is to provide the patient with the best possible care within safe medical limits. The medical team can consult with an ethics committee to ensure that their decision is ethically sound, and it has to be documented thoroughly. No? The medical team uh, documents their decision-making process thoroughly, including the rationale for their choices. And continuing supportive dialogue, the medical team is committed to continue supportive dialogue with the patient and their family. Now, I want to ask you, do you agree with this justification? Why or why not? What are some potential challenges in implementing this decision? How can you ensure that the patient feels respected and supported even when you are refusing to comply with their demands of higher dose uh, dosage of opioids? Now let's break down the moral analysis using our framework for that final decision. For the act or the object, providing pain relief within safe limits while refusing to administer harmful doses is balancing autonomy and non-maleficence. The act itself is a complex one involving both providing care and setting boundaries. No? For the intention to alleviate the patient's suffering while preventing them from harming themselves, no, is a good intention. The intention is to find a balance between respecting the patient's autonomy and protecting their well-being. For the circumstances, patient is competent, understands the risk of opioid overdose, but is demanding excessive doses due to severe pain. The context is one of a patient in severe pain making demands that could potentially endanger their life. For the outcome, patient receives pain relief within safe limits but may not be completely satisfied with the level of pain control. The outcome, though, is a compromise where the patient receives some relief but is not given everything they want. So, again, this is a very emotionally charged situation. So, what coping mechanisms can you use to deal with the stress and moral distress of caring for a patient who is demanding harmful treatment? How can you maintain your professionalism and provide compassionate care even when you disagree with the patient's choices? Okay? Now, this next case presents a conflict between a patient's confidentiality and protecting a third party from harm. I will present what is the most ethically sound approach, and I challenge you to critically evaluate, no, the reasoning. So imagine this, you are a nurse caring for a patient diagnosed with HIV. The patient reveals they're in a relationship with someone who is unaware of their HIV status and refuses to disclose it, okay, despite engaging in unprotected sex. So the partner is at serious risk. Okay, now what are your initial thoughts? What aspects of this situation do you find most challenging? The core ethical conflict lies, no, in this case, it lies in balancing the patient's right to confidentiality with the duty to protect an innocent third party from harm. How do we reconcile these competing obligations? Now let's explore ethical considerations. The principle of justice suggests that we should protect vulnerable individuals. Why is protecting an unsuspecting partner from HIV considered a matter of justice? Okay. Next, confidentiality is crucial in healthcare. Why is maintaining patient confidentiality so important? What potential harms could result from breaching it in this case? Now, in this situation, the most ethically sound course of action is to report the case to public health authorities. This is a difficult decision, but the need to protect the third party from a potentially life-threatening infection outweighs the obligation to maintain strict confidentiality. Because again, confidentiality is not absolute. All right? And here's the justification, which you can challenge again. No? Um, well, HIV transmission can have devastating consequences. Okay, so that's why we need to prevent serious harm. There is a duty to warn. There is a moral and, in some jurisdictions, a legal duty to warn individuals at risk for serious harm. Also, public health mandates, no, public health authorities are equipped to handle such situations while protecting patient privacy to the extent possible. And reporting to public health is a more limited breach of confidentiality than directly informing the partner. So you are not supposed to inform the partner. You are supposed to inform and report to public health authorities. Okay? Now, here are some common objections to this approach. One objection would be reporting the patient will destroy their trust in the healthcare system. Well, of course, this is a valid concern, but the potential harm to the third party is greater. Okay? Another objection would be it's the patient's responsibility to inform their partner. But while the patient has a moral obligation, the healthcare provider also has a duty to prevent harm. Okay? Another objection would be reporting the patient could lead to discrimination or violence against them. And the appropriate response should be public health authorities are trained to handle these situations sensitively. No? And they also will protect the patient's safety. Okay? Now it's your turn to challenge that perspective. Consider these questions. Are there any flaws in the reasoning? Are there any alternative ethical framework that would lead to a different conclusion? Under what circumstances, if any, would it be ethically justifiable to maintain confidentiality? In this case, even if it meant putting the third party at risk. What are the legal requirements for reporting HIV cases in this jurisdiction? What support services should be offered to both the patient and the third party in this situation? So you can take note again of your answers. You can even debate the merits of your proposed solution. You formulate arguments that supports or oppose the position that was discussed a while ago, and we can, you can continue your uh, deliberation, because this is how you polish, this is how you enhance, you develop your ethical reasoning. Okay. Now, here's another case. The case explores the conflict between a wealthy patient's demand for experimental treatment and the fair allocation of limited resources. Um, So, what do you think is the most ethically sound approach? No, I challenge you to critically evaluate, no, the reasoning. Imagine this: a wealthy patient demands an experimental treatment that is not proven effective. This treatment requires significant hospital resources and would deny those resources to other patients with better prognosis. The patient is competent and offers to pay the full cost. No? So the hospital must decide between justice and autonomy. So what are your initial thoughts about this? What aspects of this situation do you think is most challenging? Because the core ethical conflict, in this case, lies in balancing the patient's autonomy with the principle of justice. Does the patient's ability to pay override the need for equitable access to care for all patients? Now let's explore the ethical considerations, before the final decision. The principle of justice requires that we distribute resources fairly. So think about it. Why is providing experimental treatment to one wealthy patient at the expense of others considered a potential violation of justice? On the other hand, competent adults generally have the right to make their own medical decisions, even if those decisions seem unwise. So, why is respecting patient autonomy considered so important? Are there limits to this right? Now, in this situation, it is said that the most ethically sound course of action is to deny the wealthy patient's demand for experimental treatment. While respecting their autonomy, the hospital's primary obligation is to allocate resources to fairly and prioritize treatments with proven effectiveness that benefit the greatest number of patients. So here is the justification for that action or that decision, which I also encourage you to challenge. So, on fair allocation, healthcare resources are limited. So, it must be allocated fairly to all patients. On medical effectiveness, treatment with proven effectiveness should take priority over experimental treatments with uncertain benefits. For on the principle of the greatest good for the greatest number, resources should be used to benefit the greatest number of patients. And on the autonomy limitations, autonomy does not extend to demanding resources that would unfairly disadvantage others. Okay? However, there are some objections to this approach. No? And these are the ways we can address these potential objections. One objection would be the patient is willing to pay for the treatment, so it won't cost the hospital anything. The response could be the cost is not just monetary, it includes the use of scarce resources like staff time, equipment, bed space, no, that could be used to treat other patients. Also, another objection would be the patient has a right to choose their own treatment, even if it's experimental. The response should be the right to choose treatment is not absolute and must be balanced against the needs of other patients and the principles of justice. Another objection would say denying the patient the treatment could be seen as discriminatory. But we can respond by saying that the decision is based on medical effectiveness and resource allocation, not on the patient's wealth or status. But it's your turn now to challenge that perspective. Consider these questions. Are there any flaws in the reasoning, no, the justification for the action, which is to deny the wealthy patient's demand for experimental treatment? Are there any flaws to the reasoning? Are there any alternative ethical framework that would lead to a different conclusion? Under what circumstances, if any, would it be ethically justifiable to provide experimental treatment to the wealthy patient? And how should hospitals balance the needs of individual patients with the needs of the community as a whole? So again, you can write your thoughts about these things in your journal. Now, here's another case that explores the conflict between a patient's right to refuse information and a doctor's duty to tell the truth. Um, and we will also discuss the most ethically sound approach. But I also challenge you to critically evaluate the reasoning. Now imagine this, a patient with early stage treatable cancer explicitly states, I don't want to know if I have cancer. The patient is competent and understands the implications. The doctor must decide between respecting the patient's autonomy, no, their right not to know, and veracity, which is the duty to tell the truth. Now, I would like to ask you, what are your initial thoughts about this? And what aspects of this situation do you find most challenging? Okay. The core ethical conflict, no, in this case, lies in balancing the patient's right to autonomy, and in this case, to refuse information even about their own health, with the physician's duty of veracity, to be truthful and honest with patients. Now, the question is, does the patient's right to refuse information override the duty of veracity in this case? Now, let's explore the ethical considerations. For autonomy, patients have the right to make decisions about their medical care, including the right to refuse information. Now, I would like to ask you, why is respecting patient autonomy considered so important? What are the potential benefits of allowing patients to make uninformed decisions? On veracity, physicians have a duty to be truthful and honest with their patients. But I also would like to ask you, why is veracity considered a core ethical principle in medicine? What potential harms could result from withholding information from patients, like in this case? Now, in this situation, the most ethically sound course of action is to respect the patient's wish not to know their diagnosis, at least initially. However, this decision should be approached, no, with gradual engagement, balancing respect for autonomy with ongoing efforts to build trust and offer truthful information when the patient is ready. Okay? And the justification for that is, which of course you can challenge later on, no? Is that patients have the right to choose. Patients have the right to choose not to know information about their health. And that autonomy includes the right to refuse information. Veracity, on the other hand, is not absolute and can be balanced with respect for patients' wishes. What's important is to build trust. Building trust over time is essential for effective patient healthcare worker relationship. Okay. However, there are of course some objections to this approach. Okay, the patient might say, or one objection could be, the patient cannot make informed decisions without knowing their diagnosis. And one appropriate response would be, while ideal, autonomy also allows. No? Autonomy allows for the refusal of information. Focus on discussing treatment options and their implications without explicitly stating the diagnosis, if possible. Okay? Another objection would be withholding the diagnosis is dishonest and violates the physician's duty of veracity. One appropriate response could be it's a temporary respect for autonomy, not a permanent deception. The goal is to build trust and eventually provide the information when the patient is ready. Okay? Now, another objection also would be the patient may delay or refuse treatment if they don't know they have cancer. And the appropriate response would be the patient may delay or refuse treatment. Uh, yeah, emphasize the importance of, yes, the patient may delay or refuse the treatment, but we can emphasize the importance of regular checkups and addressing any new symptoms promptly, framing it in terms of general health and well-being. Okay? Now it's your turn to challenge that perspective. Consider these questions. Are there any flaws in the reasoning that was described earlier? Are there alternative ethical frameworks that would lead to a different conclusion? Under what circumstances, if any, would it be ethically justifiable to override the patient's wish not to know their diagnosis? How can physicians balance the duty of veracity with the need to respect the patient's autonomy in cultural sensitive ways? And what are the potential long-term consequences of respecting a patient's wish not to know their diagnosis? So after answering those questions, you can continue writing about this, about the merits of the proposed solution, formulate arguments that you can have, so whether it is an argument supporting or opposing the position. It will be a good exercise, no, to develop your ethical reasoning. And we are down to the last case. The last case is about organ donation. Organ donation presents a complex ethical challenge. Now, while respecting all viewpoints, of course, we're going again to discuss the most ethically sound approach in this scenario. But of course, your task is to critically evaluate the reasoning, identify potential flaws, and formulate alternative solutions if you can think of any. No? So write about them and that so that you can revisit them from the next time, because we are also going to discuss organ donation in a separate chapter. Okay, so now let's imagine this. You are a nurse caring for a patient who has been declared brain dead following a severe accident. The patient is a registered organ donor, but the family is hesitant to consent to the donation. They are struggling with the loss of their loved one, of course, and are unsure about whether they can bring themselves to authorize the donation. They express concerns about their cultural beliefs, their religious beliefs, and their personal feelings about organ donation. Now, I would like you to think about this case. What are your initial thoughts and feelings? What aspects do you think in this situation you find most challenging? Okay, so take note of them as well. Now, the core ethical conflict, no, in this case, lies in balancing respect for the patient's previously expressed autonomous wish to donate their organs. That's why nga they are registered organ donors. No? So, balancing with the family's current emotional state, cultural beliefs, and their role as surrogate decision makers. Now, how do we reconcile these competing obligations? Let's explore the ethical considerations. The patient's registration as an organ donor, no, represents their informed and autonomous decision. In most ethical frameworks, a competent adults' prior wishes should be given significant weight, even when they conflict with the desires of the family members. But I would like to ask you, why do you think is respecting autonomy so important even after death? You take a pause, take note of that question. Maybe you can research about it and yeah, add them also in your notes. Let's talk about the family's grief and cultural beliefs. The family's grief and cultural beliefs are undeniably important and deserve also our utmost respect and sensitivity. However, should these considerations automatically override the patient's prior autonomous decision, especially when that decision could save lives? So, where do we draw the line between respecting cultural values and upholding individual rights? Now, in this situation, the most ethically sound course of action is to gently and compassionately advocate for honoring the patient's prior decision to be an organ donor while acknowledging and respecting the family's grief and concern. The healthcare team has a responsibility to uphold the patient's autonomous wishes, which were made when they were competent and able to make their own decisions. Now, here's the justification for that action, which of course you can challenge. No? The patient's decision to become an organ donor was an exercise of their autonomy. It's a fundamental ethical principle. Organ donation can save the lives of others, fulfilling the principle of beneficence. Organ donation promotes justice by ensuring that those in need of transplants have a chance to receive them. And while families have a right to make decisions for their loved ones, the right is not absolute and should not override the patient's prior autonomous wishes, no? Except, of course, in extraordinary circumstances. And the healthcare team has a duty to advocate for the patient's wishes even after death. Also, those are the justifications. But of course, there can be objections, no? Um, and here are some common objections. The family is too distraught to make a rational decision. So that's an objection. And we can appropriately respond by saying, provide compassionate support and counseling, but don't let temporary distress invalidate the patient's prior wishes. Okay? Another objection could be, our cultural beliefs forbid organ donation. And a response could be, acknowledge and respect these beliefs, but explain that the patient made a different choice. Explore whether there are any culturally sensitive ways to honor the patient's wishes. Okay? And another objection could also be, we don't feel like we know what the right thing to do is. So one appropriate response could be, offer to connect the family with the resources and support groups to help them make an informed decision. Now it's your turn to challenge that perspective. Now, consider these questions. Are there any flaws in the reasoning? Are there any alternative ethical framework that would lead to a different conclusion? Are there any cultural or religious beliefs that would justify overriding the patient's autonomy in this case? What are the potential long-term consequences of prioritizing autonomy over family wishes in cases like this? And under what circumstances, if any, would it be ethically justifiable to disregard the patient's prior decision to be an organ donor? So of course, I want you to write your answers, to take note of your answers, so you can revisit them later. No? You can discuss about the merits of the proposed solution. Take a few minutes to formulate your arguments, whether your argument is in support or in opposition to the opinion or to the position. So That's a way for you, to grow in ethical reasoning. Now, as we end the discussion on ethical evaluation, I want you to see that ethical practice in healthcare is not just about memorizing principles. Um, yeah, we discussed the different ethical principles, but we did not stop there because I wanted you to see that this part is not just about memorizing principles, it's about integrating them in real patient encounters. Like in beneficence, which means to do good. Beneficence reminds us that our intention must always be to promote the patient's well being. Every intervention, every assessment, every recommendation must answer the question, does this truly benefit the patient? So that is what beneficence is all about. On non-maleficence, which means to do no harm, doing good is not enough. We must also ensure that we do not cause harm. Harm is not only physical, it can be emotional, psychological, or even relational. And ethical practice requires vigilance, not just action. Okay? So, yeah, then the next is justice or fairness. Justice challenges us to be fair. In resource limited settings like the Philippines, justice becomes very real. Who receives attentions first? Who has access? Justice reminds us that healthcare is not just personal, it is actually societal. Okay? On autonomy or self determination, autonomy reminds us that patients are not passive recipients of care, they are decision makers. Respecting the autonomy means respecting informed choices, even when those choices differ from our preferences. Now, these four principles guide us, but ethical practice does not stop there. Supporting principles would include confidentiality, which that protects trust, veracity that protects the truth, fidelity that protects commitment. Even the principle of double effect reminds us that complex decisions sometimes carry unintended consequences and we must evaluate them carefully. Okay? Also, there are special principles like legitimate cooperation and the common good remind us that we work within systems, not isolation. The principle of stewardship, integrity, and even the ordinary versus extraordinary means principle help us to make difficult end of life and resource decisions. And importantly, we do not participate in abstraction. We practice within the Philippine legal framework, the Patient's Bill of Rights, the informed consent laws, the constitutional protections. Because ethics is not only moral reflection, it is also legal responsibility. Now, in our context, to consider for cultural considerations, family involvement, respect for elders, and non-confrontational communication, of course, shape how ethical principles are applied. So, cultural sensitivity must be observed, but cultural sensitivity does not replace ethics. It refines it. Okay? So, what does this all mean? That ethical principles are not separate boxes. They work together. They guide us to ensure a patient-centered care. So as we conclude, I don't want you to remember this session as a list of theories and principles. I want you to remember how they work together. like for ethical theories that guide nursing actions. No? Ethical theories, whether deontology, teleology, or virtue ethics, give us the lens through which we evaluate actions. They shape how we reason. They influence how we justify our decisions. They help us move from instinct to disciplined moral judgment. Okay? On the core principles that protect patients' rights, the principles of autonomy, beneficence, non-maleficence, and justice are not just abstract ideals. They are safeguards. They protect the patient's dignity. They protect safety. They protect fairness. When you are unsure, these principles anchor you. Okay? On balancing autonomy and professional responsibility in real practice, principles do not always align neatly. Autonomy may conflict with beneficence, justice may challenge personal preferences, and that is where ethical evaluation becomes essential. Nursing is not about choosing convenience, it's about balancing responsibility. And virtues makes ethics real. Virtues such as honesty, humility, compassion, prudence, and courage transform these principles into practice. You can know the right thing, but without courage, you may not act on it. You can understand autonomy, but without respect, you may not honor it. Okay? Informed consent is not just a signature, it is an ethical conversation. It reflects transparency, respect, and shared decision making. And when cases become complicated, bioethics guide complex decisions. End of life issues, limited resources, conflicting values. Bioethical principles provide structure. They prevent decisions from becoming purely emotional or purely procedural. So, what is the real takeaway, no, from this chapter? That ethical theories help you think, ethical principles help you decide, virtues help you act. And then when these three align, your thinking, your decisions, and your character, that is ethical competence. Technical knowledge allows you to treat illness. Ethical wisdom allows you to care for persons. And when ethical principles become part of your habits, not just your notes, you begin to practice with integrity. So this is Miss Cañete. Thank you everyone for joining me in this session.